Hello, I'm Dr. Victoria Rodriguez. I am a general adult psychiatrist with more than 10 years of clinical experience. At the moment, I work as a consultant in an NHS early intervention service in London, and I am a visiting research fellow at the Institute of Psychiatry, Psychology and Neuroscience at King's College London, where I completed my PhD and I continue to be involved in research and academic work. I decided to start working in private around 4 years ago to have a more personalized space where I can support people with a broader range of mental health difficulties, including one of my main personal interests, which is neurodivergence, including giftedness in adults. I was always fascinated of how the human body and mind work, which is why I'm still involved in research. That curiosity is still there. But what attracted me the most of this profession is the role of supporting and caring for others, to have a sense of having a positive contribution, if you like. I have very early memories, even when I was 3, 4 years old, that I was naturally curious and willing to understand those around me that may be behaving differently, and had a special empathy and compassion for them, wanting to approach, make them feel appreciated and supported. I actually entered in the medical school with the determination of becoming a psychiatrist. Because what I love about psychiatry is that while any other specialty, you're mostly treating a disease, in mental health, it is all about the individual with the unique particularities that make every one of us different and special. Psychiatry offers the privileged position of being there for someone that is opening up to allow you to get to know part of who they are. I had my own personal journey with some mental health challenges, so I could get a more direct understanding of how mental health challenges can place us as a particular vulnerable place, which made me understand that I want to be there to support others in similar positions. What I find most rewarding about my work is seeing a sense of relief and transformation in my patients, whether as a change in their symptoms or a shift in the way they perceive the situation from a more empowered position. It's incredibly fulfilling to witness someone who's been struggling even with a long-term condition to regain hope and a sense of control over their life. It's not always a quick fix and often involves introspection, learning, self-knowledge, self-actualization. But the way I want to look at it is that sometimes mental health difficulties allow room for that growth and end up with us being better suited for the possible future challenges to come. So I believe my patients value my empathy, my genuine approach to understand their experiences. I love to be able to offer like a safe, supportive, not judgmental environment when people feel comfortable sharing their most vulnerable thoughts and feelings, where they can feel heard, respected, no matter what they are going through. I tend to not just focus on the symptoms, but the individual experiences with those symptoms, essentially to understand the person behind the possible diagnosis so that we can work together to find the best path forward. I think my patients also appreciate that the collaborative nature of our work together. I encourage them to take part, like an active role of the treatment decisions, whether it's therapy, medication, lifestyle changes, because I truly believe that their input is vital in creating a plan that works for them. I want them to feel empowered in their own healing journey, and I think the sense of partnership is something they value.